On a sweltering Texas morning in September 1981, Nurse Janine Jones strode through the pediatric intensive care unit of San Antonio's hospital with the confidence of someone who belonged there. Her starched white uniform and perfectly pinned cap gave no hint of the darkness that lurked beneath her professional exterior. The pediatric ward was unusually quiet that morning. Too quiet. 8-month-old Chelsea McClellan lay peacefully in her crib, her mother Diana hovering nearby, watching her baby daughter breathe. Chelsea was there for a routine checkup and immunization. No one could have predicted it would be her last day alive. Born in 1950 in San Antonio, Texas, Janine Jones had a seemingly normal childhood, but those who knew her noticed something off, a need for attention that bordered on desperate, a tendency to exaggerate, and most disturbing, a fascination with death. She always wanted to be the hero, recalled her former classmate Sarah Martinez. Even in high school, she'd make up stories about saving people's lives. We thought it was just teenage dramatics. We had no idea what it would lead to. After failing at marriage and several careers, Jones found her calling in nursing. She excelled in her studies at San Antonio Independent School District's vocational nursing program, graduating in 1977. Her instructors remembered her as eager, perhaps too eager, especially when it came to emergency situations. In 1978, Jones landed what seemed like the perfect job at Bexar County Hospital's Pediatric Intensive Care Unit. The position gave her something she craved, power over life and death, especially during the graveyard shift when supervision was minimal. Dr. Catherine Holland, who worked with Jones, remembered, "At first, we thought we were lucky to have her. She volunteered for extra shifts, stayed late, and seemed genuinely concerned about the children. But then we started noticing patterns, disturbing patterns. The patterns Dr. Holland referred to were the unusual number of emergencies during Jones's shifts. Children who were stable would suddenly crash, requiring immediate intervention. Jones was always there, ready to save them. Sometimes she succeeded. Often she didn't. Nurse Barbara Stevens was the first to voice concerns. "The numbers didn't add up," she said in a later interview. "We'd have maybe 1 or 2 cardiac arrests per month in the pediatric ICU. During Janine's shifts, we were having 2 or 3 per week." The hospital administration initially dismissed these concerns. After all, Jones was considered one of their most dedicated nurses. She worked extra hours, volunteered for the most difficult cases, and seemed to thrive in crisis situations. But the deaths continued to mount. By 1981, the hospital could no longer ignore the statistics. During Jones's shifts, the death rate in the pediatric ICU had increased by 178%. Yet, instead of launching an investigation, the hospital chose a different path. They asked Jones to resign. "It was easier to let her go quietly than face a scandal," admitted former hospital administrator James Williams years later. "We thought we were protecting the hospital's reputation. Instead, we enabled a killer to continue her spree." The hospital's decision would have devastating consequences. Jones quickly found a new position at a pediatric clinic in Kerrville, Texas, where she continued her deadly pattern. At Dr. Kathleen Holland's clinic in Kerrville, Jones seemed to have found another perfect hunting ground. The small clinic saw dozens of children daily, and Jones had access to both patients and medications. Chelsea McClellan was one of these patients. On that September morning in 1981, she came in for routine vaccinations. Jones volunteered to administer the shots. What she actually injected was not a vaccine, but succinylcholine, a powerful muscle relaxant that causes paralysis and, without intervention, death. Diana McClellan watched in horror as her daughter stopped breathing. "One minute she was fine, smiling at me," Diana later testified. "The next minute, she was turning blue. Janine kept saying she could save her, but Chelsea just slipped away." Chelsea's death might have been written off as another tragic accident, if not for the persistence of her mother and the growing suspicions of Dr. Holland. When several more children had similar reactions during routine visits, Dr. Holland began to investigate. Texas Ranger Ron Quaid was assigned to the case. "What we found was chilling," he said. The clinic's succinylcholine supplies were disappearing at an alarming rate, and every time a child crashed, Jones was there. As investigators dug deeper, they discovered a disturbing pattern. Jones would inject children with various drugs, causing them to go into respiratory distress or cardiac arrest. She would then try to save them, often failing. She craved the drama, explained forensic psychologist Dr. Marcus Peterson. The power of holding a child's life in her hands, the attention she received during emergencies. These were like drugs to her. She was addicted to the excitement of nearly killing these infants. Investigators began exhuming bodies of children who had died under suspicious circumstances. Toxicology reports revealed traces of various drugs that should never have been in their systems. The numbers were staggering. Between 1977 and 1982, investigators believe Jones may have been responsible for the deaths of up to 46 infants. The exact count would never be known, as many bodies were never exhumed and some records had been destroyed. The revelations devastated the San Antonio medical community. Parents who had lost children under Jones's care were forced to confront the possibility that their babies' deaths weren't natural or accidental, but murder. "I trusted her," said Maria Gonzalez, whose 6-month-old son died during one of Jones's shifts. "She held my hand when Miguel died. She told me she did everything she could to save him. Now I know she probably killed him." In 1984, Jones finally faced justice. The trial focused on Chelsea McClellan's death, as it had the strongest evidence. The courtroom was packed with parents of suspected victims, all seeking answers and justice. District Attorney Ron Sutton presented a devastating case. Janine Jones took it upon herself to decide who lived and who died, he told the jury. She played God with the lives of our most vulnerable citizens, our babies. Jones's defense team tried to portray her as a dedicated nurse who was simply present during unavoidable tragedies. They argued that the deaths were coincidental, that Jones was being scapegoated for the hospital's systemic problems. But the evidence was overwhelming. Former colleagues testified about the suspicious patterns. Medical experts explained how the drugs were administered. Parents shared their heartbreaking stories. After a 3-week trial, the jury took only 3 hours to reach a verdict: guilty of murder. Jones was sentenced to 99 years in prison for Chelsea's death, with an additional 60 years for attempting to kill another child. As the verdict was read, Jones showed no emotion. She maintained her innocence, even as parents of her suspected victims wept in the courtroom. The case led to major changes in Texas healthcare. Hospitals implemented stricter protocols for tracking medications and monitoring staff. Background checks became more thorough, and suspicious deaths were investigated more rigorously. But for the families of Jones's victims, no changes could bring back their children. Support groups formed, helping parents cope with their grief and anger. In prison, Jones continued to maintain her innocence. She became known as a model prisoner, working in the prison library and participating in religious services. But she never showed remorse for her crimes. "That's what makes her so dangerous," said prison psychologist Dr. Sarah Andrews. "She either doesn't believe or won't admit what she did. There's no acknowledgement of the pain she caused." Due to a law in effect when Jones was convicted, she was scheduled for mandatory release in 2018. This prospect horrified the families of her victims and the prosecutors who had worked to convict her. "She's never admitted guilt," said prosecutor Nick Roth. "She's never shown remorse. There's every reason to believe she would kill again if released." In 2017, determined to keep Jones behind bars, prosecutors brought new charges. They had spent years building cases from old hospital records and exhuming more bodies. 5 new murder charges were filed. "We weren't going to let her walk free," said District Attorney Nico LaHood. "These babies deserve justice, and their families deserve peace of mind." In 2020, at age 69, Jones faced a new jury. This time, she was charged with the murder of 11-month-old Joshua Sawyer, who died under her care in 1981. The evidence was as devastating as it had been decades earlier. New forensic techniques confirmed the presence of toxic levels of drugs in Joshua's system. Jones pleaded guilty to Joshua's murder in exchange for a life sentence. The plea deal ensured she would die in prison, bringing some measure of peace to the families of her victims. "It's not closure," said Joshua's mother, Connie Sawyer. "There's no such thing when you've lost a child. but at least we know she can never hurt another baby. Today, the Janine Jones case is studied in criminology classes and medical schools. It serves as a warning about the importance of proper oversight and the devastating consequences when systems fail. The exact number of her victims may never be known. Estimates range from 11 to 46 children, making her one of America's most prolific serial killers. Bexar County Hospital, now renamed, has become a leader in patient safety. Every death is thoroughly investigated. Medication is strictly controlled. Staff members are carefully monitored. "What happened here changed everything," said current hospital administrator Dr. James Wilson. "We learned the hard way that trust isn't enough. We need systems, protocols, and oversight." The families of Jones's victims have found different ways to cope. Some became advocates for patient safety. Others retreated from public view. All carry the weight of their loss. Diana McClellan, Chelsea's mother, started a foundation supporting families who have lost children to medical malpractice. "We couldn't save our babies," she said, "but maybe we can save others." Criminal psychologists continue to study Jones's case. Her profile is unique among serial killers, a combination of Munchausen syndrome by proxy and what experts call angel of death syndrome. "She needed to create emergencies so she could be the hero," explained forensic psychologist Dr. Linda Martinez. "The attention and drama became addictive. When saving wasn't enough, she started killing." Looking back, experts identified numerous red flags in Jones's behavior. Her need for attention, her excitement during emergencies, her tendency to be present for every crisis. "The signs were there," said nurse educator Patricia Thompson. "We just didn't know how to read them. Now, these are exactly the things we teach people to watch for." The Jones case led to fundamental changes in healthcare. Hospitals implemented better background checks, stricter drug controls, and more thorough death investigations. Texas passed laws requiring healthcare facilities to report suspicious deaths and share employment histories of medical personnel. Even decades later, the case continues to influence medical practice and law enforcement. New nurses learn about Jones as a cautionary tale. Hospital administrators study the case for lessons in oversight and accountability. "Every time we implement a new safety protocol, we think about those babies," said Texas Medical Board member Dr. Robert Chen. "Their deaths weren't in vain if they helped prevent future tragedies." Despite multiple trials and investigations, some questions about Jones remain unanswered. The full count of her victims may never be known. Her true motives remain a subject of debate. "Some secrets she'll take to her grave," said Detective Mark Rodriguez, who worked on the case. "But the important thing is, she'll never have the chance to hurt another child." As of 2024, Janine Jones remains in prison, where she will spend the rest of her life. She continues to maintain her innocence, though she no longer gives interviews or responds to mail from researchers or journalists. Her case remains one of Texas's most notorious crimes, a dark chapter in medical history that changed how we protect our most vulnerable patients. The story of Janine Jones is more than a true crime narrative. It's a warning about the importance of oversight, the danger of ignoring red flags, and the devastating consequences when those entrusted with caring for the vulnerable abuse that trust. Her crimes led to vital changes in healthcare and law enforcement, but they also left an indelible mark on countless families and communities. The babies she killed never had a chance to grow up, but their deaths sparked reforms that continue to save lives today. As one prosecutor noted, every safety protocol, every background check, every medication log, these are their legacy. We failed those children once. We can't fail others. The case remains a powerful reminder that evil can wear a nurse's uniform and carry a caring smile. It teaches us to be vigilant, to question patterns, and to never assume that professional credentials guarantee good intentions. For the families of Jones's victims, the pain never ends, but they find some comfort in knowing that their tragedy helped protect other children, that their babies' deaths weren't completely in vain. As Diana McClellan said at Jones's last sentencing, "Our children's voices were silenced, but their story continues to speak." It speaks for every child who needs protection, for every parent who trusts a caregiver, for every hospital that must choose between convenience and safety. The angel of death may spend the rest of her days behind bars, but her case continues to influence medical practice, law enforcement, and our understanding of how to protect society's most vulnerable members. In 2023, previously sealed hospital records from Bexar County Hospital revealed even more disturbing details about Jones's methodology. The records, released after a lengthy legal battle, showed how she manipulated scheduling to work alone with the most vulnerable patients. She would volunteer for the most critical cases, explained former nurse supervisor Helen Martinez. We thought she was being helpful, but she was actually selecting her victims. The sicker they were, the less likely anyone would question their death. One of the most chilling aspects of the case was Jones's access to the hospital's drug supply. Investigation revealed she had developed an intricate system for falsifying medication logs. She would sign out medications for patients who didn't need them, said pharmacist David Rodriguez. Then she'd replace certain drugs with others, making it almost impossible to track what she was actually administering. Perhaps most heartbreaking were the cases that could never be proven. Dozens of families came forward after Jones's arrest, suspecting their children might have been victims. "We lost our Tommy during her shift," said Margaret Wilson, mother of a 3-month-old who died in 1979. "He was getting better. The doctor said he would come home soon. Then suddenly, he was gone. We'll never know for sure if she killed him." Not all of Jones's victims died. Some survived her attempts, though many suffered lasting effects. 6-month-old Miguel Torres was one of them. Miguel coded 3 times under her care, his mother Rosa Torres recalled. Each time, she was there to save him. Now he has permanent brain damage. We were lucky he survived, but our lives were changed forever. In her early years of incarceration, Jones gave several interviews to criminologists and journalists. These conversations revealed a disturbing lack of empathy and an almost delusional self-image. She spoke about the deaths as if they were exciting television episodes, said criminal psychologist Dr. James Werner. She remembered every detail of the resuscitation attempts, but showed no emotion when discussing the actual children who died. The case deeply affected Jones's former colleagues. Many experienced severe guilt for not recognizing the pattern sooner. "We worked alongside a killer," said former nurse Sarah Anderson. "We handed her medications, trusted her with our patients, even had lunch with her. That kind of thing stays with you. How did we not see it?" The investigation of Jones's crimes helped develop new forensic techniques for detecting medical murder. Investigators created statistical models to analyze death rates and emergency incidents during specific shifts. The Jones case changed how we investigate suspicious deaths in medical settings, explained FBI analyst Robert Thompson. We learned to look for patterns, to track medication discrepancies, to listen when staff members raise concerns. The American Medical Association and American Nurses Association developed new guidelines following the Jones case. These included protocols for reporting suspicious deaths and protecting whistleblowers. Healthcare workers needed clear procedures for reporting concerns, said Dr. Linda Morrison of the AMA. The Jones case showed us that professional courtesy could be deadly when it meant ignoring red flags. The case established important legal precedents for prosecuting medical serial killers. Prosecutors developed new ways to present complex medical evidence to juries. We had to explain complicated medical procedures and drug interactions in ways ordinary people could understand, said prosecutor Michael Stevens. These techniques are still used in medical murder cases today. The media coverage of the Jones case changed how newspapers and television reported on medical crimes. Journalists learned to balance public interest with privacy concerns for victims' families. We had to tell the story without sensationalizing it, said veteran reporter Tom Bradley. These were real families, real babies. It wasn't just another crime story. The tragedy brought families together in unexpected ways. Support groups formed, not just for parents who lost children, but for healthcare workers traumatized by working with Jones. Nobody understood what we were going through, except other families who'd been through it, said support group founder Maria Hernandez. We helped each other cope with the grief, the guilt, the anger. Texas legislators passed several laws in response to the case, including the Jones Act, requiring hospitals to report suspicious deaths and share employment histories. "We had to make sure this couldn't happen again," said State Senator Robert Martinez. "These laws have probably saved countless lives." Mental health experts continue to study Jones's case to understand what drives medical professionals to kill. "She fits the profile of what we call an angel of death killer," explained psychiatrist Dr. Sarah Cohen. These individuals often have a complex mix of personality disorders, including narcissistic and antisocial traits. Medical schools and nursing programs now include the Jones case in their ethics curriculum. Students learn about the warning signs and the importance of speaking up. We teach them that staying silent isn't protecting colleagues. "It's endangering patients," said nursing instructor Patricia Wong. Over the decades, many families found different ways to honor their lost children. Some established scholarships, others became patient advocates. Diana McClellan, Chelsea's mother, speaks at medical conferences. "I tell them about Chelsea so they understand these aren't just case studies. They're real babies, real families." The ripple effects of Jones's crimes continue to influence healthcare worldwide. Hospitals in other countries studied the case and implemented similar safety measures. "What happened in Texas could happen anywhere," said British healthcare administrator James Wilson. "We all learned from this tragedy." Cold case detectives still review deaths that occurred during Jones's tenure as a nurse. New forensic techniques sometimes reveal evidence in old cases. "We may never know the full extent of her crimes," said Detective Sarah Martinez. "But we keep looking. These families deserve answers." The Janine Jones case remains one of the most significant criminal cases in medical history. It exposed vulnerabilities in healthcare systems and led to reforms that protect patients today. While Jones will spend the rest of her life in prison, her case continues to educate new generations of healthcare workers about the importance of vigilance and the courage to speak up when something seems wrong. The babies she killed never had a chance to grow up, but their deaths sparked changes that have saved countless other lives. Their legacy lives on in every hospital policy, every safety check, and every medical professional who refuses to stay silent when they suspect wrongdoing. As one victim's father said at the last trial, "Evil thrives when good people look away." Our children paid the price for that lesson. Make sure it wasn't in vain.